My name is Dr. Jeffrey Lyman, and I'm one of the co-investigators for the study for which you're considering participating in. Dr. Tim Lovell is the other co-investigator. In addition to Dr. Lovell and myself, we have several other providers that are involved in the study. The purpose of this study is to investigate a novel technique that can be used in association with total knee replacement to help minimize the use of narcotics after surgery. In my experience, the most common source of complications after knee replacement surgery is related to the use of narcotics. These complications aren't what you might expect. Most patients think of complications like addiction or dependency with the use of narcotics, and while those are potential problems, we don't see that very often. Most commonly, complications such as nausea, urinary retention, constipation, confusion, and general malaise accompany the use of those medications. What I have found is that if we can minimize the use of narcotics after knee replacement surgery, patients are more likely to have a reliable and pleasant recovery. You have been invited to participate in this study because you are planning to undergo knee replacement surgery. You have received an informed consent about the study. I'm going to explain the risks and benefits and what you can expect during the procedure. The technique that we are investigating involves temporarily disrupting the function of some of the deep sensory nerves of the knee joint prior to surgery. We call this technique radiofrequency ablation, or RFA, of the geniculate nerves. The genicular nerves are deep sensory nerves that help provide pain sensation from deep inside the knee joint. By selectively blocking these nerves with a radiofrequency ablation procedure, the pain associated with knee arthritis can be dramatically reduced. The genicular nerves do not involve any motor function or superficial sensory function around the leg. Therefore, by participating in the study, you should not experience any skin numbness or weakness with your leg. To determine the effectiveness of this procedure, it is necessary to include a sham group in our study. And there are actually two different types of accepted radiofrequency ablation procedures that are in use today. The first is a traditional approach, and the second is a cooled radiofrequency ablation. This makes 3 total groups in our study, any of which you may be randomized into. All 3 groups require a light general anesthetic. The standard or traditional radiofrequency ablation requires 4 small needles be inserted around the joint and radiofrequency ablation probes entered to block the nerves. The second technique, which is a more advanced version, involves a cooling process which may increase the footprint of the radiofrequency ablation probe in the knee joint. In theory, this may be a more reliable procedure. Finally, some explanation should be made about the sham group. If you are randomized into the sham group, you will undergo the same anesthetic for the first 2 groups, and needles will be placed in your skin during this procedure. However, no thermal injury will be done to the nerves inside the knee. This group is required so that we can prove that there is a difference between doing something and doing nothing at all to these nerves. Neither the patient nor Dr. Lovell or myself will know which group you have been randomized to at any point during your participation in the study. It is only upon study completion when we'll know the final results about the effectiveness of this procedure. Regardless of which group you get randomized into, it appears that there are very few complications associated with these interventions. However, all theoretical complications are listed on your consent form, and you should carefully review these before consenting to participate in this study. The duration of nerve inhibition appears to be 6 to 9 months. This procedure has been performed for years around the world in various areas in the body and appears to be quite safe. The nerves do appear to regenerate and their function returns after that period of time. Again, I'd like to thank you for your time and consideration for participation in the study. Your participation is critical so that we can provide important clinical data which may be far-reaching. Again, thank you very much.
So as part of the procedure, we will be using X-ray guidance. So we will bring you back to a room like this where we have a mobile X-ray machine to take pictures of your knee during the procedure. We will take pictures first to get our anatomic locations. 4 placements will be used. One on the upper inside portion of the knee, upper outer portion of your knee, a far outside portion of the upper knee, as well as an inferior or lower part of your knee on the inside. These needles are all placed using X-ray guidance, and their location is confirmed by using different images from the side and the front. The needles will be placed that have an active tip. A small portion of the end of the needle will heat up to cause an injury to the nerve that transmits pain from the knee joint back up through the central nervous system. The purpose of this is to disrupt the signal, so you take away those pain signals generated from the joint. So following the procedure, the Band-Aid should be left in place for 1 day. We ask that you not bathe in a hot tub, public swimming pool, lake, or bath for 24 hours following the procedure to allow adequate healing of the sites for needle placement. The Band-Aids can be removed after 1 day.
My name is Alicia Coyne, and I'm the Clinical Research Director for this clinical study. I'll be working with you throughout this trial. Some of our physicians have gone over the purpose, the procedures, and some of the risks and benefits you might encounter. Now, I will walk you through other portions of our informed consent and help you better understand the study. You will be one of approximately 150 patients who qualify and can participate in this trial. By now, Dr. Lyman and Dr. Lovell have talked with you about the trial, invited you to participate, and given you an informed consent. They also have referred you to one of our 3 treatment providers at Pleasant View Surgery Center for your radiofrequency ablation treatment. Upon your arrival at Pleasant View Surgery Center, we will go over the informed consent with you again, either with me or one of our treatment providers. At that time, you can ask any questions that you may have, and we'll answer them thoroughly before you consent. At that time, we will also randomly assign you to one of the 3 treatments that have been described to you by Dr. Lyman. The standard traditional radiofrequency ablation, the cooled radiofrequency ablation, and the control simulated procedure will be paid for by the study. This is the only portion of the study that will be paid for. The doctor appointments, the surgery itself, and your physical therapy rehabilitation are all standard of care and will be billed to your insurance and are your responsibility. I will be working with you for up to 1 year following your total knee replacement surgery. None of your personal information will be shared with the public. However, I will ask you to sign a medical release form, which allows us to gather information from your physicians, the hospitals you've been seen in, and the physical therapy sites. You may withdraw from the study at any time, and this will not affect your standard of care or treatment. There is a sub-study that goes along with the main study that involves physical therapy. You'll be offered participation in the physical therapy sub-study at the same time you consent to the main study. You will have an option of choosing from one of our 28 participating physical therapy clinics throughout the region. You'll be able to find a clinic near you to best accommodate your rehabilitation. The physical therapy sub-study involves routine essential rehabilitation following your total knee replacement. There is nothing experimental about the physical therapy sub-study. We are simply gathering information about your care and your rehabilitation. You have been given a copy of the informed consents. They will be addressed with you again and all questions answered at Pleasant View Surgery Center on the day of your procedure. Thank you for allowing me to share this information with you and for considering to participate in this study. I look forward to meeting you and working with you throughout this trial.